there is a meeting coming up of the AAPMD. It's October 17th to 19th in Nashville, Tennessee. So we want to see you there. Hi, I'm Duane Grummons. I'm a board-certified orthodontist with emphasis upon facial orthopedics. My message will be upon pediatric airway, the problems and resolutions. I want to emphasize clinical cures and remedies for these patients, and then have you go home with useful information that you can apply with your approaches in the lives of these kids. So these problems are largely underdiagnosed, and that means sometimes the patients are misdirected or the problems just aren't recognized so that the kids can get the right treatment at the right time and avoid some of the end-stage problems that would occur in their lifetimes without this early intervention and preventative care. So the examination and the evaluation begins with an appreciation for the nasal airway and the lymphoids, and then we need to recognize the sleeping patterns and behaviors, the morning conditions, the daytime function and conditions, and then what happens in sleep that next night. So all of this needs to be in the minds and the awareness of us as clinicians. So the basic objectives of our evaluation and treatment is to optimize maxillomandibular function and face-forward concepts. We need to establish nasal breathing and all the good patterns of that, tongue posture and its placement, muscle function, head posture, all of these conditions that integrate and which come from collaboration with our colleagues to deliver the care on behalf of the patient. So earlier treatment is where we want to emphasize the recognition, the cures, and the remedies. Early treatment is typically with kids that are 7 to 12 years of age, and we're talking about the earlier patients, the 2 to 6 year age range, and doing things before the permanent teeth even come in. Prevention is better than cure. As an orthodontist, I need to emphasize facial orthopedic concepts and approaches. I need to have an awareness about nasal function, the influence of breathing and the inflammation influences, genetic and epigenetic influencers, the maxillomandibular development of the structural components with face-forward approaches and concepts, and then also a recognition about the functionality, the breathing, the swallowing, the posture, and all that goes on with that aspect of breathing and good care, and then how it influences sleep and breathing at night. So as an orthodontist, I have concern about the shape, the proportions, and the ratio of the facial parts. And I want to have a knowledge and recognition about airway flow characteristics. I can do a lot for the middle third of the face and the lower third. So the middle third, the nasal maxillary complex, the nasal flow, the lymphoids, all of that. And then the lower facial third, the mandibular complex, the pharynx, the hyoid, the tongue, the arches, the musculature, and all the function of that aspect. As an orthodontist, we need to have an awareness about this and help these patients earlier in the ages of 2 to 6. So after I've provided this care, the patient should have good restorative sleep and good brain function, and of course development of the facial components and room for the teeth in the arches with optimal tooth arrangement. Key point, it is better to shape the face on the kids than it is to repair the adults. So these airway-focused orthodontic approaches really bring forth good brain function, optimal breathing and sleep, and then development of the faces and great arches and stunning smiles. So why do we do this? To help each child have the best possibilities in life. This helps children to become the best version of themselves. So as a team collaborating, we can help youth to thrive, have the best brain function, the best sleep and breathing, and help them grow and behave well and be their personal best. And this puts parents at ease as well because they've gotten true help for the kids. We are in pursuit of new knowledge. So let's head off to the meeting. I'll see you there, ready to be informed. And when you come back, you will be an agent of wellness in the lives of your kids. Thank you. I'll see you.